I'm Dr. Arjun Handa, plastic surgeon at Handa Aesthetics and Plastics. Let's talk about hourglass procedure and what is an hourglass figure, how to get it done. So the first thing in understanding this topic is, first thing we need to understand what is an hourglass figure. When patients come to me, I have to explain to them that what they are looking for is an hourglass figure, because sometimes they usually are asking for something else and wanting something else. So an hourglass figure is a body type which is associated with wide chest, narrow waist and then wide hips. The different proportions of these three areas depends upon the individual preference. Some might like the proportion to be a little on the higher side, the difference to be more, and some would want the difference to be less and the ratios to be on the lower side. That really depends upon patient to patient and what their individual preference is. There are certain procedures that we combine to give an hourglass figure to a patient. One of the procedures is liposuction, where we take out the fat from the abdomen and the lower back to reduce the waistline and also to flatten the tummy. This fat is then used to increase the size of the hips and, if the patient wants, the buttocks also. The breast size has to be increased at another procedure, that is at another stage, which can be increased by fat grafting or by implants. All these procedures are done based upon individual preference again. Some may want just their waist to be narrowed because they might think, or I might think, that their hips and butts are usually of adequate size. But in case there is a hip dip depression or the butt are a little smaller in size, then we advise that at the same time as liposuction, we can use the fat to increase the size of the hips and buttocks. The breast procedure has to be done at a separate stage, because after fat grafting, it's not possible for the patient to lie down on their back. And if we do a breast procedure at the same time, it's not going to be possible, because they will have to lie down on their tummy after fat grafting to the hips and butt, and then the pressure will come on the breast. But the three components of the procedure depends upon the patient's existing body type and also on what is their preference with regards to what they want to achieve. Then comes the question that whether everybody can get this procedure done, or whether we look at certain people with certain body types who will be the ideal candidates so that they get a good result. The first criteria in getting this procedure done is that your skin quality should be good. What I mean by that is that if your skin is loose, lax, ptotic, and there are a lot of stretch marks on your skin, then that patient is usually not a very good candidate for this procedure, because then they would need something called as a tummy tuck. But with tummy tuck, we can still give them an hourglass figure, but fat grafting to the butt at the same time will not be possible. So hourglass can still be attained with a tummy tuck, but liposuction alone will not be sufficient. The next thing that we look at is the body mass index. So if we are looking at fat grafting to the hips and buttocks, for that, first of all, there should be sufficient fat in your tummy and lower back. So your body mass index should not be too low, because if it's too low, then there won't be any sufficient fat to increase the size of the hips and butt, and the procedure will not give a satisfactory result, and we'll have to look for another procedure called butt implants. But if there is sufficient fat in the body, in which people usually have a body mass index between 22 and 27, then we can give a good result. If the body mass index is higher than 27, even then the procedure can be done, provided the existing body has certain curves to it and the tummy is relatively flat with most of the fat deposits in the thighs and arms. If the body mass index is more than 27 and there is a bulging tummy, then with liposuction we won't be able to make the tummy flat. So the ideal patient would be a person with a body mass index between 22 and 27 with good skin quality. Regarding the procedure of the breast, that's again a very individualistic topic, and the patient has to come forth with it that they want to increase the size of the breast or not at the same time. Finally, what's important to note here is that a lot of patients ask about the financials. As I said, that giving an hourglass figure can involve multiple procedures done in the same stage or in different stages. So the financials also depend greatly upon individual preference, number of procedures required, and whether the procedure is going to be done in a single stage or multiple stage will be required. All these things come together to give an estimate regarding the financials of the procedure. Thank you for watching this video.